I can't hear anything.
We're going to get started in just a couple minutes, giving everybody just a couple more minutes to get on. Good evening, everyone. My name is Patrick Botts Forbes, and tonight is our third Wednesday of the month. CERT, our Community Emergency Response Team Continuing Education Training. Tonight's topic is going to be on how to prioritize survivors using the triage method. So we're going to have a scenario tonight, and we're going to walk you through the scenario step by step on how to prioritize the survivors you might encounter. As we typically do in the LA region, we have earthquakes, or at least that's the biggest concern that we all have because we can't predict when the earthquake is going to happen. We don't know how bad it's going to be, but we know that we're long overdue for one, and it could be quite catastrophic. So there's been a moderate earthquake in the early morning. The fire department is responding to critical emergencies. Power is out. Water is unsafe to drink. Cell phone networks are overloaded, and 911 rings busy or is operating in a callback only mode. What that means is that when you call 911, if you get through, they're going to tell you they're going to call you back, and then you have to hope that they will. This allows them to get people logged into the system and then allows them to start handling the calls while somebody handles the triage of the calls. Um, you knew how bad it was because you saw the coverage, you knew the power was out, your cell phone's not working, so your CERT team activates. You go to your community staging area, you start to organize, and then you deploy out three-person damage assessment teams. You've been walking your route, looking for incidents that need to be dealt with, and calling them into the staging area so that they can get a team to go to those incidents and deal with them. While you're walking back to your staging area, your team is made up of you, the team leader, a radio operator, and a scribe. You're about to make your way back to the staging area and still about half a mile away when you hear the sound of tires squealing and a loud crash. Your team runs towards the sound, and upon arriving, you find a school bus that has veered off the road, hopped the curb, crashed into a tree, rolled onto its side, and as you're staring at this scene, the back door of the bus pops open and a teenager falls out. What do you do? Tonight we're going to be using triage. Triage comes from the French word trier or to sort. What the goal of triage is really to make order from chaos. And this is primarily what you do in any kind of incident, no matter how big or how small. Um, Something unexpected, something that is overwhelming will always be chaotic. It's you can have all the plans in the world, but the world is never going to give you the exact scenario that you predicted will happen. So really the goal of what we do in emergency preparedness as community responders, even the professionals, is focused on taking that chaos and making order from it. So what you're going to do is you're going to look at what you have. You're going to see, is the scene safe? What are my priorities? Following what the number one or number two of CERT is how can I do the greatest good for the greatest number of people in the shortest amount of time? And how can I make sure that I don't bring a victim to an incident? Who needs to be helped first? And who can be saved if we can help them right now? Just as important, who can't be saved, even if I have all the resources in the world? And that's one of the hardest things that you may have to face. You might have someone there who's alive, asking, begging for help, and you see a giant gaping hole in their chest. You can see the ground below them. They won't be alive for much longer, and there's nothing you can do about it. Do you start stuffing the wound? Do you start applying tourniquets? Do you spend resources that can be used to save others on this person that you know that you can't save? Do I have the right equipment and resources to safely deal with this particular problem? How many survivors do I have? How many immediates? How many delayed? How many walking wounded? How many deceased? And then how do I identify them? We're going to use what's called the START triage method, simple triage and rapid treatment. It focuses on who's going to die in 60 seconds, who's going to die in 60 minutes, and who's going to be somewhere in between. Simple triage and rapid treatment, or the START triage method, categorizes survivors into four categories: immediate or red tagged. This person will die in the next 60 minutes without treatment. Delayed or yellow tagged, this person may die in the next 24 hours without treatment. Minor, or I prefer walking wounded or green tagged, has no obvious life-threatening injuries. And then the ones that we hope we never have to see, the deceased or expectant or black tagged. They're dead or they will die even with immediate treatment. Green tagged or walking wounded are the first people you want to get out of the way and identify. What makes someone walking wounded is, quite frankly, they walk. You call out to them and they come to you. They're able to walk out of the incident under their own power when directed to. But you don't just ignore them. You have to visually assess them as they're walking past you. Give them direction, tell them where to go, and to wait and not wander off. Oftentimes in the drills, I would say most of the time in the drills that we do, we see that the walking wounded are completely forgotten about. They're just sent away and nobody checks on them after that. It's important to realize, however, that someone might be able to get up and through adrenaline or sheer willpower actually follow directions and move. So you need to look at them and make sure that they are indeed not having a life-threatening injury. Direct them to one location nearby, say a tree, a bench, somewhere. Tell them to go over there, wait there, and then make sure that a team reassesses them after. If someone is for some reason shambling towards you, they're ashen, they're gray, it looks like they're breathing really hard, struggling to breathe, something just doesn't feel right about this person, have them sit down, wait, reassess them, make sure that they are not actually suffering from a life-threatening injury. Don't just let them wander over and then die on the green tarp. It's also important to put someone in charge of this group to make sure that others don't wander away. But also, if somebody gets worse, somebody might be injured, it's not life-threatening at the moment, but they can easily turn into life-threatening. Have them call you, make sure that they get your attention so that you can reassess and do something about this person who, might be circling the drain all of a sudden. Um, Also, what we tend to forget is that we usually have less responders than we do survivors. And so if you have walking wounded who are able-bodied, they're able to help and willing to, have them come with you. Have them provide that help. Of course, if they say no, then, don't force them to do anything. Someone is immediate when they suffer a life-threatening injury, but something can be done about this. Um, Oftentimes in trauma, the body systems start to shut down because of blood loss or some sort of traumatic injury causing shock. Shock is really when the body is trying to preserve itself to keep the body alive long enough to get medical aid. Someone going into shock is in a life-threatening situation, and they will not recover from it on their own. They need to go to the hospital. They need to go to an ER. Things that can cause shock, severe loss of blood or hemorrhage, um, a circulation disruption. So if someone's hand gets crushed, that disruption will cause the body to start to go into shock. Severe respiratory trauma, such as a collapsed lung or an obstructed airway, can definitely cause someone to have a medical emergency and die if something isn't done about that. Neurological disruptions, that's the brain or spine, if they get hit in the back or the head or the neck, this can be life-threatening for sure, can be cause paralysis or um, they may never be able to walk or use a limb again. But if they can get to the ER fast enough, that might be reversible. A lot of times, swelling will actually cause nerve damage, especially in the spine, spinal column. And so, if they can get to the hospital, get that inflammation reduced, then they can actually get reuse their limbs. Severe burns over a large part of the body is also life-threatening. And of course, we talked about shock. And shock is sometimes something that doesn't seem to have a reason, but you can tell something is not right. And this is where we have to use our best judgment when we're assessing someone. If you, if they pass all the tests that we're going to go over, but something still doesn't seem right, it's better to err on the side of making someone immediate so they get reassessed and possibly prioritized to go to the hospital than to assume, well, I don't, something feels wrong, but they passed all the tests, so I'm just going to mark them as delayed and they'll get to the hospital whenever they do. When you call out someone and they don't come out to you, and then you assess them and they don't have a life-threatening injury or an apparent life-threatening injury, and they're not dead, then they're delayed. You don't know why they didn't get up and come to you when you called out. And something is wrong then, for whatever reason. Doesn't have to be physical. They could be with their kid because the kid is severely injured and they're not going to abandon them. But by definition, if they didn't walk out with the wounded and they're not immediate and they're not dead, then they're delayed. When you're performing a rapid assessment on someone, um, you're not going to perform CPR on them. If they're not breathing and you have 10 survivors, you're not going to begin CPR, that's cardiopulmonary resuscitation, on someone, the first person that you encounter. Once you begin CPR, you're not supposed to stop. So effectively, that person is dead in a mass victim incident. And if you occupy yourself with the first dead person, then you're not going to be able to save anyone else. However, that doesn't mean you don't do life-saving techniques. If someone is spurting blood or they're not breathing, do something. Try something to save their life. Either open their airway, put something underneath their neck, stop, do direct pressure, put a tourniquet on, do something to stop that bleeding. If someone is spurting red blood, they're going to bleed out if you don't do something to stop it. And then they might be immediate now, but they're certainly going to be dead the next time you look at them. You want to identify survivors who will die in the next 60 minutes without immediate medical attention. That is what you're looking to do. Prioritize those people going to the hospital. If they're going to die in the next 60 seconds, unfortunately, there's probably nothing you can do about that. Maybe if there's ambulances rolling up right outside, then maybe there's something you can do about it. But in this scenario, an earthquake scenario, 911 is ringing busy. Chances are you're not going to get immediate response that you need. We simplify triage as saying 32 can do, and we'll go over that shortly, but that's something to keep in mind. 32 can do. 30 is someone breathing faster than 30 times a minute. I don't want you to count how many times a minute they're breathing. Don't sit there. One, two, three. No, you know what normal breathing is because you're probably doing it. If someone is breathing rapidly, that's not normal breathing. If they're breathing too slow, that's not normal breathing. Don't count the breaths, but if someone looks like they just ran a marathon and there's no reason for them to, also think about 30 times a minute, that's every 2 seconds. That's really someone panting. If you're looking at someone and they're going, that is not normal. Something is wrong. Um, if they're breathing normally, however, then you need to see another test. Does the person's, you're going to test their capillary refill. You're going to pinch the fingernail, and if it restores color within 2 seconds, that stands for normal blood flow in the system. It's a quick test to do. Now, keep in mind that some more elderly people, some people with bad circulation, some people who are extremely overweight, they might not have good capillary refill on a normal day. However, we're not judging what is a normal day for them. If they fail a test, then they're immediate. If it normally takes them 3 seconds, 4 seconds to refill capillary refill, you don't know that. Just mark them as immediate and then move on. And then can do. Can someone follow simple directions? If they can't, there's probably something going on here. So we're going to break this down into 10 easy steps on how to triage a mass victim incident or a mass survivor incident. I don't like the term mass casualty incident because casualty can also mean someone who's died. Also, the terminology has changed. We're not using victim, we're using survivor, but these are older slides and I missed this one. So I apologize. I saw someone in the chat mention it earlier. First thing you do when you arrive on scene is assess, size up, make sure the scene is safe. You're going to look at all 6 sides. What's in front of you, what's behind you, what's behind what you're looking at, what's to the left, what's to the right, what's above and what's below. A lot of times we forget to look at what's above and what's below. Is this bus underneath some power lines? And the power lines have come down on top of the bus, or it hit a power pole and the power pole's cracked and those power lines may come down on the bus. Or what caused this bus to crash? Maybe there's a sinkhole that it's sitting on top of and the ground is not stable. During drills, during refreshers, the instructors really like to throw those kinds of curveballs at you where you didn't look up or down, and that's what kills you. So it's always important to know before you go in if it's safe to. And also, Make sure you have a plan to back out safely if things go sideways. If a fire starts and you're in the bus, what if the fire's behind you? Is there another way out? If there's a fire in front of you, can you still go out the way that you came in? Is it still safe? And that goes for anything. If you're in, for those of you who have taken the CERT training and have seen the video in a nightclub and a fire starts, is the only exit the one that you came in from? Or are there alternative exits? Because if everyone is stampeding towards the entrance, they're going to probably block and not be able to make it down the hallway. If you think about some of the larger venues, 500 people trying to go into a narrow hallway is not going to work when everyone's panicking. So if there's alternate ways out, you should know this ahead of time. And use this in your day-to-day life. When you go into a supermarket, look for other exits. If you go into Costco, look for other exits. Make sure you have another way out in case the way you went in is no longer safe. Yes. In the chat, someone said, always have an escape route. Yes, absolutely. Always have an escape route and plan. And if you don't have an escape route, think about what you're going to do if things go sideways. So, step number one, you're going to clear those who don't need immediate help. These are the walking wounded, the minor or green tagged. Before you go in, you're going to yell at the top of your lungs. And we get this all the time at drills. People kind of just say it. Now you need to yell it. If you can hear the sound of my voice, come to me. Loud, direct. Say it a couple times. You want to get people's attention who are inside and get them to come out. Clear them. But don't lose or forget about them. Tell them, go over here, where we can see you. Wait here for us and look them over as they're walking past you. Make sure that they are actually not severely injured. If they look, something just doesn't seem right about them, have them stop, assess them, do the 32 can do on them. Hey, how many fingers am I holding up? Hey, let me see your hand for a second. Let me check your capillary fill. If they're breathing too fast, it's already a problem. If you see someone who's panting as they're walking past you, stop them. Don't ignore them. And of course, keep a few of the able-bodied to help you. Somebody looks like they're healthy and they're willing to, hey, can you help us? We need to go, we're going to go in there and check on everybody else, but can you help us? They say yes, great. Extra hands is going to be a massive asset. Step two, anyone who did not walk out under their own power is and is still inside is either immediate, delayed, or dead. When you go in there, there are no walking wounded, period. I don't care if the person looks healthy and is fine and is there with their kid and the kid has the problem. They are not walking wounded. They're delayed. You're going to be testing to see if they are immediate or dead. And if they are immediate, they are immediate. You're going to mark them immediate. You're going to move on. If they fail any of these tests, they are immediate. There's no need to go on and do additional tests. We want to perform this triage as quickly and efficiently as possible. If you're the only one there and there's 10 survivors, it should not take you 30 minutes to do this. It should take you 30 to 60 seconds at the most. You should be able to easily clear all 10 survivors in 10 minutes, maybe even 5. You're going to start where you stand, move methodically through the survivors. A lot of times during the drills, we have people yelling for help, and that's to distract you, get your attention. Because if you're in there and the building just collapsed on top of you, you want to make sure that you get help. You don't care about the other people who are closer to the door. You need someone to help you because you're trapped in the rubble. So you're going to be yelling, screaming for help. And that's completely understandable. But you need to methodically move through and identify everyone who is a survivor and their condition and not get distracted. If you run to the loudest person in the room, then you're going to walk past or run past other people, and you're not going to know who you missed. When you walk up to the first person, you're going to introduce yourself. Don't just start touching people. Say, I'm a first aid responder. I'm a member of the emergency response team. Or actually, when you call out emergency response team, come to the sound of my voice. When you walk up to somebody, I'm an emergency responder. How can I help you? Or not how can I help you? Um, I'm an emergency responder. Can I help you? This is actually part of the test. If they nod or they say yes, they're responsive. If they say yes or they say something, they're breathing. If they nod their head, they might not be breathing for much longer. Um, but you need to seek permission before you start touching people. If someone says no, they refuse. That's perfectly fine if they want to do that. You have 9 other survivors in this room that need your help. If someone doesn't want your help, move on. Don't argue with them. I can see that there's a metal rod sticking out of your chest. Are you sure you don't want my help? Okay, that one might be allowable. But if they're gonna fight you to help them, move on. Um, if they don't respond, now you're gonna start tapping and shouting. You're gonna tap them on their shoulders and give them a good jolt. Don't pound on them. Don't try and hurt them, but you want to get their attention. If they're asleep or they're kind of out of it a little bit, tap on them and shout, "Sir, sir, sir, ma'am, can you hear me?" You're looking at their eyes. Are their eyes fluttering? Is their head moving at all? Do they give some sort of response? Um, if not, then you look to see if they're breathing. You're going to look, listen, and feel. Don't take too long doing this. You can put your head down by their mouth and look at their chest. You're looking for chest rise. You're listening for the sound of breathing. And then put your hand on their chest. If you can feel something, then maybe they're breathing. Nothing, no signs of breathing. You're going to give them 2 chances to live here. You're going to attempt a head tilt, chin lift to open the airway. A lot of times what happens is the tongue will flop back on someone who's laying on their back and block the airway. They can't swallow their tongue. They can't, probably can't really bite it off either. But it can definitely fall back and block their airway. And so what you're going to do is you're going to push on their forehead and lift on their chin, and that's going to lift the tongue away from the airway. If they gasp for air, that's a good sign. But what happens is if you let go at that point, the tongue might just fall back on the airway and stop them from breathing again. So if they gasp for air, um, you want to put something underneath the back of their neck, a rolled up sweatshirt, for example. Or if you have one of the bystanders or walking wounded with you that can help, they can hold their airway open and allow this person to keep breathing. If they don't start breathing, they don't gasp for air, let go, give it a second, try it one more time. Give them 2 chances here. If the second time, the second attempt, they still don't breathe on their own, you're going to mark them dead or black tag them and then move on to the next survivor. Yes, there might be something you can do about it, but you have 9 other survivors who you might be able to do something for. And if you never get to them, they're all going to die. Maybe. But the thing is, you don't want to spend too much time on someone who may be dead and there's nothing you can do about it. If they do start breathing on their own, mark them immediate and move on. They may wake up. Great. Maybe they don't wake up. But if they do wake up and they start talking to you and they're perfectly fine, mark them red, mark them immediate, and move on. You don't know why they stopped breathing. There could be something else going on here. They need to go to the hospital and be checked out. There may be a quiz at the end. This is a diagram of the head tilt chin lift. So you're going to push on the forehead and you're going to lift the chin, fingers underneath, pulling the jaw away from the head to allow the tongue to be moved off the airway. If the person is responding and allows you to help them, um, don't just start touching them. Um, they don't know who you are. They don't know why you're there. There's been a traumatic incident and they're probably scared. If you go start touching them, especially if, say, it's a woman and you're a large football player like male who's intimidating, maybe covered in tattoos with giant beard, not that all people with tattoos and giant beards are intimidating, but you don't want to cause more trauma here. Just explain what you're doing. Tell them what you're doing before and as you're touching them. You're also pretending you're narrating for the camera that's probably recording you. This is a CYA issue here. You're covering yourself by narrating what you're going to do. And it will probably put the person at ease if they know what you're doing. The worst thing here is you'd start touching someone and they look shocked and go, "What are you doing? Why are you touching me there?" That is the worst case, one of the worst case scenarios. It gets far worse than that, but you don't want to surprise them. Just say, "Hey, I'm gonna check your capillary refill. Can I see your hand?" Or that looks like it's bleeding. Can I check it and see if I can do something about it? Stop the bleeding. Can I push here? Can you hold here? Just narrate what you're doing, explain to them, and also your partner as well. You're going to be observing this person. See, you've already verified that they're breathing. They're responsive. So now you need to find out, are they breathing too quickly? This is that 30. Are they breathing more than 30 times a minute? Are they breathing more than every 2 seconds? Or are they breathing too slowly? If something doesn't look right, something is wrong, someone there's a thing called agonal breathing. When someone is dying, their body cannot get enough air and they're not breathing normally, and they gasp for air maybe once every 30 seconds. That's twice a minute. That's not breathing. Something is wrong here. Um, but if something really seems wrong, they're breathing too fast or way too slow, mark them immediate. Move on. If they're breathing normally, again, you know what breathing normally is because you're doing it. Then move on to the next test. You're going to check skin perfusion. Here's where you're going to have to touch your survivor, your patient, is you're going to ask to see their hand and say, "I need to squeeze your fingernail. I want to see what your make sure your blood circulation is normal." You're going to pinch the fingernail here. I don't have a picture of it, but um, the fingernail has a color to it, and if you pinch it and let go, it turns white and then goes back to normal. If they have fingernail polish, and you can't see the capillary refill, then you can also look at the palm of the hand and push there in the center and see it goes white and then goes back to normal color. You can also pinch the lip. This is a absolute last resort. You don't want to pinch someone's lip when you have other options. But if that is your last resort, pinch the lip, and if it goes back to normal color, then within 2 seconds, then that indicates good skin perfusion. This is to test for shock. When someone's going into shock, the body is pulling blood away from the extremities, away from the fingers, away from the lips, away from the nose, and pulling it towards the center of the body to keep that blood circulation perfusing the lungs, the heart, the key organs, the brain, make sure that they have a chance to survive longer than if the blood is flowing out towards the side. If someone has a crushing injury or they've lost a limb, something has, or they're hemorrhaging blood, they're losing blood, they're going to go into shock. And this is going to be readily apparent when you do the skin perfusion check. If it does not return to normal in 2 seconds, mark the person immediate and move on to the next victim or survivor. If the skin color does return to normal within 2 seconds, you're going to move on to the final test. Can they follow simple directions? Don't ask them, what's your name? You don't know their name. They might not know their name. If they say something obviously incorrect, um, do you know that it's incorrect? I mean, how many people have some pretty wacky names out there right now? Um, Ask them to follow simple directions. Also, be careful about asking questions that they might not know on a normal basis. What day of the week it is? I know it's Wednesday because I'm giving this presentation. Do I know if it's Thursday or Tuesday on a normal week to week? Maybe, maybe not. What time is it? I don't know. I'm not looking at my watch. I'm not looking at a phone. I've been busy. It feels like it's 9 o'clock when it's really 3 o'clock. And don't ask questions like that. Ask them if they can follow simple directions. When you introduce yourself, if you stuck your hand out and they shook it, people instinctively shake hands. However, some cultures, this is not true. They don't touch, or especially if it's a different gender, they won't shake your hand. So that doesn't necessarily mean that they can't follow simple directions. But if they did this, it's an indicator. They shook your hand when you extended it. It's an indicator that things are okay. Now, follow my finger with your eyes. Just your eyes, not your head. If they turn their head and they're following it, or if they can't, or one eye is moving and the other is not, something might be wrong here. You're building suspicion. How many fingers am I holding up? If they say three or two when you're holding up four, something's not right here. Don't ask them 20 questions, but ask them a couple just to get a baseline to find out, I think something's wrong, or I think it's okay here. Um, they might not also understand the language you're speaking, and you really don't have time to pull up a translator app to figure out what it is. So this is why if you just stick your finger in front of their head and ask them to follow your finger with your eyes, they probably will do it even if they don't speak your language. Again, if you shake their hand, they shake your hand when you extend it to them, and they don't speak your language, it's something that is instinctual. It's normal. You're building this suspicion. Do I suspect there's a problem or do I suspect that things are okay here? If you can't figure it out, if they don't seem mentally coherent, if you have concerns, something doesn't seem right here, mark them immediate and move on. Otherwise, if they appear to be breathing normally, if their capillary refill refills within 2 seconds, and they appear to be following directions, you're going to mark them delayed. Remember when you walked in to this. If they weren't walking wounded, because they left when you called out for them, and they're not dead or immediate, then they're delayed. There's no other conditions here. There's no other what ifs. Either walking wounded And if you're inside the building, there's no walking wounded in there, or they're dead, or they're immediate, or they're delayed. So, meanwhile, back at the crash, for those of you joining us late, there's been a moderate earthquake in the early morning. The fire department is responding to critical emergencies. Power's out, water is unsafe to drink, cell phone networks are overloaded or maybe up and down. Your cell phone may or may not work. If you can get to 911, it's either ringing busy or they're operating in a callback mode where they are getting your number and they'll call you back as soon as they have an operator available. You have deployed with your CERT team and you're on a three-person damage assessment team. It's been deployed, you're walking back to your staging area, and your team is made up of a team leader, a radio operator, and a scribe. As you're walking back to the staging area, about a half mile away from the staging area, you hear the sound of tires squealing and a loud crash. You run towards the sound, and upon arriving, you find a school bus that has veered off the road, hopped the curb, crashed into a tree, and rolled onto its side. The back door of the bus pops open and a teenager falls out. What do you do? You are going to check to see if the scene is safe. You're going to assess your priorities. You're going to attempt to do the greatest good for the greatest number of people in the shortest amount of time. You're going to see who you can help first, see who you can save if you can help them right now. You're going to not try and save the people who you can't save, even if you have all the resources in the world. And you're going to make sure you have the right equipment and the right resources to safely work this particular problem. You're going to do what you can with the resources you have. We are giving you guidelines here. These are not hard and fast rules. You are a human being. You're not a robot. We're going to give you tools to make the judgment calls that you're going to have to make. But a lot of times you're going to be in a gray area. And what matters is that you do something. Even if it's not the right thing, you did something. But we're going to try and guide you along the way so that hopefully you do the right thing. But sometimes the right thing and the wrong thing are very close to each other, and you're just going to have to do the best you can. What do you ask first? Is the scene safe? Step 0. Make sure that you look at all 6 sides, front, back, left, right, above, and below. Don't head straight in. You're gonna okay. Um, Before you go in, send a team around the bus. Make sure that there's no other threats there. There's no hanging power lines. There's no gas leaking. There's no sinkhole that this thing is in that's going to suck up the entire bus and the rescue team that's inside. And if it's not safe, back away. Don't go in. If you do go in, if it is safe, proceed with caution. Make sure you have a backup plan. What do we do if things go south? How do we get out of here safely? Proceed with caution. Do I have the right equipment and resources to safely work this particular problem? If there's only 3 of you, you need more resources. Guaranteed. Do I call for the resources now, or do I inspect and see what I have and then call for the resources? The professionals who have a lot of resources available will call in all the resources they think they're going to need ahead of time. And then they can always send resources home or discontinue resources. It's better to call for help now and say, I need this, this, and this. I need an incident response team. I need a medical team. I need to set up a medical triage site, medical treatment area. Um, and then find out that you don't and say, oh, false alarm. Everything's okay. The bus has been here for 6 days. Caltrans marked it. There's no one here. Sorry about that. Then you go in, 15 minutes go by, you've assessed everybody, and then you call for help. And now it's going to take another 15 to 30 minutes to get help. You wasted time there. Make sure help is on the way. Call for backup or additional resources before you need them. When you're calling on the radio, we do what I call the five W's. Who are you calling? Who are you? Where are you? What do you have? And what do you need? When you format your radio message this way, it's gonna sound good, even if you are uncomfortable using the radio. Write down these five W's and call in using this method, and your radio communication is going to be pretty good. Who are you calling? Who are you? Where are you? What do you have? And what do you need? It's going to sound something like this. Staging. This is Alpha Team with emergency traffic. Alpha Team, go ahead with your emergency traffic. Staging. This is this is Alpha on Cleveland Avenue, about a block up from Terrace 49 at the park. We have an overturned school bus with unknown number of injuries. We need a medical team at our location. We will begin triage and get back to you with more information. Called this in early, and you're asking for help so that help can get mobilized and get on the way towards you. Alpha, your incident number is 7. We have an incident response team en route to Cleveland Park, ETA 15 minutes. Update us on incident 7 when you have a count. Who are you calling? Who are you? Where are you? What do you have? And what do you need? The format that we've been pushing is 3-person damage assessment teams. That's a team leader, radio operator, scribe. For those of you in other cities, other parts of the country, you might do things different than we do. But however it works for you, that's what you're going to go with. Our incident response teams are 5 or 7 people. That same team leader, radio operator, and scribe, but 1 or 2 additional working pairs who are actually going to do the work. Team leader, as a general rule, is always hands off and remains a safe distance away from the scene. This way, if something happens to the rest of the team, that team leader can call for help. If they're inside the incident and the building or the collapses on top of them, or the bus falls into the sinkhole with the team leader and the radio operator and the scribe and the working pairs all inside, might not be able to call for help. But if that sinkhole happens and the rest of the team falls in, team leaders outside of the area, outside of the sinkhole, they can call for help. The team leader can take over the duties of the radio operator and scribe so they can become a working pair. Now, again, these are general guidelines. The main thing is that the team leader's job is to keep everyone else safe. If the team leader is diving in hands first and has lost situational awareness, they're no longer the team leader. They're now just someone who's focused on the problem and not keeping anyone else safe. You're going to start triaging. You look for signs of danger or instability as you approach the bus. You send your 2 members around to do a quick circle around the bus, looking for any bad signs such as fire, a gas leak, down power lines, or other vehicles or thrown survivors. Before you approach, you call out, "If you can hear the sound of my voice, come to me." A teenager that fell out of the back of the bus, back door, stumbles towards you. A couple more jump out and come towards you. As you look them over, you confirm they appear okay. You ask them, "Hey, can you help us? We're going to go check on your friends." One of them agrees, the other 2 shake their heads. You point them to the nearby tree and say, "Okay, that's fine. You 2 wait for us here. Don't leave. We're going to go check on your friends. We're going to be back out to check on you." You're a 3-person team. You're the team leader. You can't go into the bus. And if that's what you guys do, that's fine. But under ideal circumstances, take the radio, take the clipboard from the scribe. Say, okay, I'm going to wait here where if something happens, I'm going to call for help. You two go inside and start triaging. Um, there's a couple ways you can do this. Um, the way I'm going to talk about is you're going to assess everybody. You're going to find out how bad it is, triage everyone, and then report out. Other teams may do this where the first survivor they encounter, they remove, and then they go back in. And the second survivor they encounter, they remove and go back in. I'm concerned that that will take a lot longer than if you initially do the triage, because remember, you're addressing life-threatening injuries as you go in, as you're starting the triage. So if you can do this in 10 minutes and triage 10 patients, if you're removing them one at a time, it's going to take you probably 5 times as long to do this. Someone may bleed out. Someone who is not breathing may stand a chance if you can get to them soon enough and open their airway. But if you're treating each survivor and pulling them out as you encounter them, um, you might not save everybody that you might have been able to. But there are people on here from Tennessee, from Alaska, from New Jersey, from Alabama, from Florida. You're all going to do things differently. Even other parts of Southern California, going to do things differently. Do your standard operating procedures, do your protocols. Um, but the way I'm going to teach it is that you're going to assess each person, you're going to triage them, you're going to address any life-threatening injuries, you're going to tag them, and then you're going to move to the next person. And you're going to assess everyone that's in there before you start extracting. Now, if another team shows up and that team that you called for is 15 minutes out, they can start pulling people out as they go in. And they're probably going to take the immediates first. However, they may take them as they encounter them. Just because, what if this is an unstable situation? If this is a building that you're in and there's risk of aftershock and you have to go and you decide to go for the immediates first, it may take longer and you may save less people than if you start extracting as you encounter them. Guidelines here, it's going to be your call. Do what you think is right. Do what your protocol says to do. So you take the clipboard, you send your team in, tell them to triage, and the teenager that wants to help, is going to go in. Survey, triage each survivor, document the numbers, immediates, delayed, dead. Remember, your walking wounded have already gotten themselves out. They've walked away from this. If you're using triage tape to do the triage, you can rip off a piece of the tape and stuff in your pocket for quick accountability. If you're using triage tags, you're going to rip off the piece that's on the side, stick in your pocket for accountability. But you want to have a count of how many survivors, how many immediates, how many delayeds, how many dead. When you're tagging people, always mark on the same spot for consistency. Agree ahead of time. Okay, we're going to tag on the right wrist. Unless they don't have a right wrist, then we're going to tag on the left wrist. If they don't have either wrist, right ankle. So that when you're going through, you're trying to look quickly. We're going to extract the immediates first. You're looking at the right wrist of everybody. Yellow, 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 black, yellow, red. Okay. But if you don't know where the tag is, it's going to take you longer to find it if you have multiple teams and they're all doing something different. All right, fun time here. So let's see. See if we can do this quiz here. All right. You should have had pop up um, a poll. Now, first survivor your team encounters. Male, 15. breathing normally, alert and coherent, complains of sharp pain in his leg, 2-second capillary refill or skin perfusion. He can answer questions and perform simple tasks. However, he has a large gash on his leg and is bleeding heavily. What do you triage him as? The poll popped up in front of you. You can go ahead and mark walking wounded or green, delayed or yellow, immediate or red, or dead or black. Don't submit. We're gonna do the quiz in real time, so we'll just scroll down for each survivor as we go through. Okay, so 74% said immediate, 21% delayed, and 14% walking wounded. Good, no one said dead. However, the walking wounded have already left the bus. So this would either be delayed or immediate. Um, Remember the 32 can do. Are they breathing more than 30 times a minute? Breathing normally. Are they able, what's the skin perfusion? 2 seconds. Is it more than 2 seconds or 2 seconds or less? If it's 3 seconds, they've got a problem. If it's 2 seconds, it's normal. And can they perform simple tasks or answer questions? The answer was breathing normally, normal skin perfusion, and they can answer and perform simple tasks. So they wouldn't be immediate. They did not fail any of the tests. They're delayed. However, this is where I throw the gray area in here. They have a large gash on their leg and it's bleeding heavily. This is the trick here. This person may become immediate if you don't do something about the bleeding. What you can do is tell the person to apply direct pressure on the injury. You can get something, a jacket or something, apply direct pressure, tell the walking wounded who's helping you to apply direct pressure. If you have a tourniquet, this might be the time to use it. It used to be that people said don't use tourniquets because they're going to lose the limb. However, in this case, help is coming, hopefully. We're in, at least in Los Angeles, we have trauma centers everywhere. So the chances of them getting to the hospital and having something done about the tourniquet is less of an issue than if you're out in the middle of nowhere. What the real problem is, if you don't do something about this and they bleed to death, they're dead. So this person is delayed, but do something about that bleeding. Put a tourniquet on, apply direct pressure, have the kid apply direct pressure, the teenager apply direct pressure, have the walking wounded apply direct pressure. Do something about that. All right. Survivor number 2. Female, 16 years old, breathing rapidly, breathing fast, alert and coherent, complains of stomach pain. She's visibly pale, 5-second perfusion. She can answer questions and perform simple tasks, has no visible signs of bleeding. What do you triage her as? Did everybody submit? I got 2 people doing this. Let me see if I can end the poll and restart it. Okay, relaunch the poll. Don't hit submit. Scroll down to Survivor 2. Go ahead and answer. So remember, immediate or red, someone has a life-threatening injury. They're going to die in the next 60 minutes if you don't get them to the emergency room. Delayed or yellow means that someone does not have a life-threatening injury yet, and they can wait for a little bit, but should probably still go to the hospital. If someone's in shock, are they yellow or red tagged? Are they immediate or delayed? So the answer here is for several reasons, immediate or red. She's breathing rapidly. That was your first clue. Um, her skin is visibly pale and it takes 5 seconds for her capillary refill. So those two signs mean, yeah, she's probably in shock. Something's going on. She might have internal bleeding or something else is going on. But you're going to mark her red, immediate. She needs to go to the hospital sooner than later, or she's going to die. All right, survivor number 3. Scroll down to 3 on the poll. Female, 14 years old, not responding, not responsive, not breathing. She does not resume spontaneous breathing upon your first head tilt chin lift. You stop, you let go, you do it again. You do the head tilt chin lift a second time, and she gasps for air. You check her skin perfusion, 2 seconds. She regains consciousness and can answer questions and perform simple tasks. There's no visible signs of bleeding. What do you triage her as? Uh, use the poll. Is this poll not working? Don't hit submit. Just there's 10 survivors here. Scroll down. Okay. All right. Maybe this isn't working. This was a bad idea. Okay. So people are coming in all over the place on this one. Delayed, delayed, delayed. This one's a trick. Um, if someone is not breathing and you do the head tilt chin lift on them and they start breathing, even if they regain consciousness, you don't know why they stop breathing. Yeah, after she starts breathing again, the tests, she doesn't fail any tests, and so she should be delayed. But because she was not breathing and you had to open her airway to get her to start breathing, she is automatically red. You don't know why she stopped breathing. So, this is a trick question here. Um, Head tilt chin lift to get her to open and start breathing again, and she does. Mark her red, immediate. She needs to go to the hospital and be one of the first ones at. Yeah, you don't know why. She could, yeah, head trauma could be. She might have hit her head and stopped breathing, and that happens. You hit your head hard enough, you're going to stop breathing. You start breathing on your own, maybe, but just if someone's unconscious, they lose consciousness. That's bad. You don't know if she has internal bleeding. You don't know if she's got a hematoma or something building in her brain, and she needs to go to the hospital and be assessed. All right, survivor number four, male 13-year-old, breathing normally. However, lethargic and responds slowly to your questions. Capillary refill is 2 seconds. Doesn't know where he is or what's going on, and cannot perform simple tasks. No visible signs of bleeding. What do you triage him as? Got a few people saying immediate. One person saying delayed. Triage is as a normal teenager. Yeah. No, the age doesn't factor in here as much. What's normal for a teenager or normal for someone who's overweight, or elderly, it's simply 32 can do. Fail or no fail. Yeah. Immediate. The person's lethargic. It's not just that they respond slowly to your questions. Um, I mean, it is. They might normally be slow to answer and lethargic. It's that this person is confused. They don't know what's going on and they can't perform simple tasks. That's really the trigger, not the lethargy or the slowness of response. However, even if the person could follow simple directions and did know where they are, if they were lethargic and slow to respond to questions, I would probably still mark them as immediate just out of concern because that doesn't seem normal. It might be normal for him, but definitely if they can't perform simple tasks or they don't know what's going on, mark them as red, mark them as immediate. Survivor number five, 12-year-old female, not responsive, not breathing, does not resume spontaneous breathing upon first head tilt chin lift. You let go, try again. Does not resume spontaneous breathing upon second head tilt chin lift. For some reason, she still has a 2 second capillary refill, but she can't answer questions nor perform simple tasks. There's no visible signs of bleeding. What do you triage her as? There's no red slash dead. They're either red tagged, yellow tagged, black tagged, or green tagged. Yeah, I think this one is pretty obvious that she's not breathing. You do the head tilt chin lift. You can't get her to breathe again twice. She may still have blood flow. The heart still may be beating, but this is expectant. If you can't get her to breathe, her heart will stop. She will die. And if you spend too much time trying to get her to breathe, you might not be able to save someone else who you could save. But this is one of the gray area questions we want to throw at you because you want to save this person. It's a 12-year-old girl. She still has a heartbeat. She still has capillary refill. You want to save her, but you don't know why she's not breathing. She could have a collapsed lung. She could have a crushed trachea. You don't know. And there's nothing you can do about it. You gave her two chances. Unfortunately, She is black tag. She is dead. Survivor number six, female, 13 years old, breathing rapidly, alert, coherent, complains of sharp pain in her leg. 4 second perfusion. She can answer questions and perform simple tasks. A large gash on her leg, blood begins to spurt upon examination. What do you triage her as? What do you do? I closed the poll because no one was using it. Just go ahead and use the chat. Yeah, pretty much everyone's saying immediate. Um, she's immediate, yeah, for multiple reasons here. Breathing rapidly, 4 second skin perfusion. She's going into shock. She's going into shock probably because of the large gash on her leg. And if it starts spurting blood, the femoral artery in the thigh, someone can bleed to death in less than 5 minutes if it's spurting, hemorrhaging blood. You need to do something about this. This is where you want to put a tourniquet on, possibly two tourniquets, depending on if you can't get the blood to stop squirting with the first tourniquet. Um, this is not a put direct pressure on, then try a pressure bandage, then go to a tourniquet. This is a throw a tourniquet on above the injury, above the gash, and try and stop that bleeding. And it's gonna hurt. You're gonna warn her this is gonna hurt. But if you don't do something about this bleeding, she will die. She will die pretty quickly. By the time you finish assessing the remaining survivors, she'll be dead. So, tourniquet, stop the bleeding, red tag, move on. Survivor number seven, 12-year-old female. Breathing very slowly. Lethargic, responds slowly to your questions. 2 second perfusion. She can answer questions and perform simple tasks, but everything slowly. No visible signs of bleeding. What do you triage her as? By the numbers, 32 can do. She's not breathing more than 30 times a minute. Her skin perfusion is 2 seconds, and she can answer questions and perform simple tasks. But something doesn't seem right here, does it? Um, you would be correct if you did by the numbers and said delayed. But this is where I would mark her immediate because I'm suspicious that something's going on here. It may be her normal, but I don't want to err. I want to err on the side of caution and mark her as immediate. But if you mark her as delayed, that is by the numbers, correct. But this is a wobbler for sure. Um, Strangely slow. The breathing is abnormally slow. When we do the 32 can do, it only talks about 30 as the number. But if you look at someone and they look like they're breathing way too slow to be normal, something doesn't seem right. She could be going into shock and her body is still trying to figure itself out. Something else could be wrong. You don't know. It's better to mark her as immediate and get her looked at sooner than later. Survivor number eight, male, 17 years old, gasping 4 times a minute. Eyes are wide, can't talk, skin is ashen. 5 second skin perfusion. Cannot answer questions, but can perform simple tasks. No signs of bleeding, but severe bruising on the neck. We triage him as. Oh, everyone's immediate on this one. Yeah, something's wrong here. Something is very wrong here. That skin perfusion, definitely red tag. Um, but this is something that you walk up on this person and you're not testing this person. You're throwing a red tag on them immediate. This is when you look at a person and go, "Oh my God, this person is on death's door." Um, there's nothing you can do about it, but this person needs to go to the hospital and be one of the first ones in that ambulance. They will be dead very quickly. Something is obviously wrong here. Survivor number 9, female, 17 years old, breathing normally, alert and coherent, complains about pains in her abdomen every 10 minutes, 2-second perfusion. She can answer questions and perform simple tasks. Oh, by the way, she's 9 months pregnant, and there's clear liquid on the seat and floor beneath her legs. What do you triage her as? This is the one we love to throw at you. The other one is the pregnant male, which always throws people for a loop. Bunch of people saying immediate, few people saying delayed here. This one's a wobbler. This one, by the numbers, breathing normally, 2-second skin perfusion, can answer questions and perform simple tasks. Is her going into labor make her immediate? For water broke, um, does anybody know how long, uh, what the average time someone for their first child is in labor for? I think it's 20 hours. If she just went into labor, unless this is her maybe, third or fourth kid, hopefully not, um, she's got time here. If the numbers were different, if she was breathing fast, if her skin perfusion was 3, 4, 5 seconds, if she was confused, couldn't follow simple tasks, definitely immediate. However, by the numbers, the fact that she's pregnant, the fact that she's going into labor here does not make her immediate. If something is going wrong, it'll probably show up in the skin perfusion and the breathing. If something is going wrong with the pregnancy, she'll start breathing fast. She probably will start breathing fast at some point if she's in labor. So chances are she'd be immediate, but based upon the 32 can do, not the fact that she's in labor right now. Survivor number 10, male, 50 years old, breathing rapidly, alert and coherent, complains of sharp pain in his leg, 5-second skin perfusion, can answer questions and perform simple tasks. However, his legs are pinned underneath the steering wheel. What do you triage him as? Yeah, straight up immediate. Why? 5-second skin perfusion. The breathing rapidly. So you walk up on this person, you see him breathing rapidly, immediate. Don't even check the skin perfusion. Mark him red. Um, and this person is trapped. It may be hard to get this person out. Um, Additionally, crushing injuries, if his legs are pinned under the steering wheel and it's crushing, you need professionals to remove him. If someone has been trapped for an extended period of time, this accident just happened, but if this person was there for maybe a couple of hours, a crushing injury where the limb has died, has been without blood for an extended period of time, when you remove him and the flow resumes, that the necrotic tissue, the tissue that has died, has not had blood flow, will poison him as it returns back to normal. So be very careful about extracting someone who's been in a crushing injury or trapped and has had no blood flow to their extremities for an extended period of time. Just happen, you get them out right away, less of a concern, but certainly for a couple hours, big concern. So, things to remember about triage. You did pretty good. Threw a lot of curveballs at you guys. Of course, the poll was curveball number one because everybody hit submit after the first one. Um, but pretty good. Um, I knew where the curveballs were, and I got a few of you, but some of them were wobblers. It could either be delayed or immediate. Um, and either way you go, trust your judgment and just do what you can. Just don't take too long in doing it. Reassess, retriage constantly. Everything is changing. Um, you do your first walkthrough, and then your second team shows up and starts pulling people out. They're going to reassess. They're going to retriage. They get to the treatment area. They're going to reassess, retriage. They're going to get into an ambulance or be taken to a hospital in the back of someone's um, car. They're going to get reassessed and retriaged when they get to the hospital. Things will change. Someone might be delayed right now, and things change and suddenly they become immediate. Someone might be walking wounded right now, and then things change and they become immediate. Worst case, they're walking wounded right now and they drop dead in front of you. That's unfortunate, may happen. Nothing you can do about it. Accountability is key. How many survivors do we have? How many in each category do we have? We have 3 immediate, 2 delayed, 5 walking wounded. Um, Track them. Tag them. Make sure you know who your immediates are. Who needs to go to the hospital first? Always tag on the same location. So from a quick glance, you look at everybody's right wrist, you see the tag, okay. Um, who's this person without a tag on their right wrist? Did we miss this person? Do we need to retriage them? Or did someone just tag on the wrong side? They tagged on the left wrist for some reason, and now we just wasted time reassessing someone who didn't need to be reassessed. Talk to your team ahead of time and agree upon using the same terminology. If you're going to use colors, use colors. If you're going to use the terms immediate, delayed, walking wounded, deceased, or dead, use those. If you're going to do red, yellow, green, do that. But don't mix and match terminology here. I don't like using the word minor because in this situation, you had people who are minor who are under the age of 18. You had minors because they were walking wounded. They got up and left. What do you mean by the word minor? I like the word walking wounded because it is descriptive. It is no question. Is this a 12-year-old minor or 12-year-old walking wounded? Um, Someone's asking about triage for kids age 10 and under with respirations and capillary refill. I believe the capillary refill on a 10-year-old is going to be less than 2 seconds for sure. However, it is true, younger kids will breathe faster. Um, but for the sake of this, 32 can do is your rule. If they are breathing too fast, and again, you're not going to count the respirations. You're not going to count how many times a minute they're breathing. If someone is breathing more than every other second, something is wrong. If they're breathing every other second, something is wrong. The age of the child does not matter here. After the initial triage, have a plan to move the survivors out so they can be treated and or transported. You're going to recess, retriage constantly. For the immediates, you're going to be paying special care to them because um, they need that attention, especially the people who are bleeding. Make sure if you put a tourniquet on that you stop the bleeding. If they're starting to bleed again, you might have to tighten up the tourniquet or apply a second tourniquet. If you did a pressure bandage or you did direct pressure, you bandaged an injury and it's still bleeding, then do something about it. Put more gauze down, tighten it, apply a pressure bandage, do something. If you can't get the bleeding to stop, apply a tourniquet. Before moving the survivors, you might have to wait for backup to do so safely. However, if, say, the bus catches fire and now everyone who's in the bus is in danger of dying, if you don't do something about it, do what you can with what you have. If you have to drag people out to get them away from the fire, um, if someone, the saying is if someone has a neck or spine injury or head injury, you don't want to move their neck and you want to pay special care and attention and protect the injury. If they are at risk of burning to death, get them out. Yeah, you might make the injury worse, but dying in a fire is way worse than, well, I'm not even going to say that. I would prefer not to die in a fire if that comes to it. Um, if you can't get others out, and it's unsafe and your team is at risk, get out. Sorry. I'm not dying in a fire because I tried to save someone who is still going to die in the fire along with me now. Don't forget about the walking wounded. Every drill we do, don't forget about the walking wounded. Reassess them, make sure that they're actually okay, and put them to work if you can until backup arrives or maybe even after. So, as a bonus, there's things you can do with triage in your day-to-day life. Um, Triage is about making order of chaos. You can use the triage method to sort into categories and prioritize things. And I don't know how busy you guys are, but I'm very busy. And so using triage to prioritize things in my life can benefit me and hopefully it can benefit you. The way I categorize things, does something have to be done right now or it's going to cause problems later? If it is, it's red tagged. I need to do this immediately. However, some things are important, but now it's too late. It already got bad. It won't get any worse if I put it off later. It's black tagged. Don't forget about it, but it's not the priority. The priority are things that are going to get worse if I don't do something about it. Is something easy to take care of right now but isn't critical? I'm going to green tag that. Everything else is yellow. Again, you're testing to see what needs to be done right now and what can be delayed. Um, if you have a lot of things that need to be done, it's overwhelming. Sometimes accomplishing just one thing gives you that sense of, I at least did one thing. Um, versus I have all these tasks, it seems overwhelming, and I can't get anything done. Accomplishing one task can give you momentum sometimes to get things done. Um, and at least make you feel like you accomplished something. In the military, um, during boot camp, I'm not prior service, but for those of you who are who I thank you for your service, but they have you make your bed first thing in the morning because you're in for a long day, an overwhelming day. And at the very least, at the end of the day, if you accomplish nothing else, you get back to your bunk and your bed was made. You accomplished at least one thing in that day, even if it seems like you accomplished nothing else. And that just feels better. At least I did something. Sometimes working on everything and accomplishing nothing just makes everything feel harder. Red tag. If it needs to be done today or things will get worse, Get it done today. That's at the top of your list. Other things can wait. If you have multiple things that need to get done today, try and focus on one thing at a time. Again, trying to accomplish multiple things, working on multiple things at the same time, you might get a little bit done for everything and still not accomplish anything. And if you can at least get, if you have three immediates that need to be done today, or things are going to get bad, and you accomplish none of them, all three things are going to get worse. But if you accomplish one of them, at least only two things get worse. Don't forget about the green tag things. Sometimes if it's not important, but you can just knock it out, get it done, at least you got something done. Don't focus on all the things that are not important and that you can get done at any time. Do one of them, knock it out, just get it off your plate, then move on to the other things that are more important. But at least you got something done. I'm pretty sure this is if I just focus on the easy tasks that don't get anything, that are of no value, it's called procrastination, which is its own problem. Black tag. Um, some things have deadlines. Um, if they become late, they'll incur penalties. But sometimes it's one penalty, or maybe it's a penalty every 30 days. You already incurred the penalty, but you have now 30 more days before you incur the second penalty. As long as it doesn't get worse, it's not the priority to get things done. Don't forget about it, because just like a dead body, it'll start to stink if you don't get it done. If you let it get to that second 30 days and incur another penalty, it just got worse. But however, if I don't have to worry this for another 30 days, maybe I'll deal with it in 15 days. Don't get to day 29 and then try and accomplish that thing that you should have done 15 days ago. Yellow. These are the worst things that you have to deal with, really, because um, they have a priority. They're not the most high priority. Um, and there's always going to be something that's a higher priority. But if you always deal with the higher priority and the things that are non-critical, then you never get the things that are yellow tag done. They still need your attention and they actually take more time to work on than a critical or minor problem. These are the things that just you hate to deal with them. And these are the things that you're going to procrastinate on. But if you'd never get these yellow tagged items done, it just leads to stress and anxiety. And it's something that you have to fit in. If you can deal with a red tagged item, get done the priority, and then knock out a yellow task, you're going to feel so much better about it. But I can't tell you to work on yellows when you have reds either. The importance triage um, is prioritizing and making order out of chaos. However, you can't let yourself lose sight of the big picture, the situational awareness. You need to be aware of everything else going on around you. Yeah, you have a bus full of kids, a bus full of injured teenagers. However, you can't forget that this bus may catch on fire because it slammed into a tree. Or I need to get in there and treat these injured and get them out when I didn't look to see. Maybe it wasn't a tree, it was a power pole. And now power lines, energized power lines are now dangling on the bus or on the ground around the bus. And if we even go near the bus, we end up dead. Don't get sucked in and blind to the dangers and the changing conditions around you. You have to always, always, always keep your situational awareness. Now, this is where the leader comes in. The team leader can stay outside the bus, keep an eye on things. If things look like they're changing, they're shifting, things are going to get worse, things are going to get dangerous for the team, that team leader can pull the team out. Let them focus on the priorities, what's in front of them. But this is where that team leader can't also get sucked in too. If the team leader's an EMT and wants to get bloody and save lives, they're maybe not the best person to be the team leader. Reevaluate constantly, but don't second guess yourself. Don't overthink it. 32 can do. Are they breathing more than 30 times a minute? Is their capillary refill more than 2 seconds? Can they follow simple directions? Is the person pregnant and in labor? Doesn't matter. 32 can do. However, is something wrong here? Something just doesn't feel right. I'm still going to mark them immediate. Be decisive in your decision making, but don't be stubborn. If new information presents itself, don't refuse to listen to it. Don't double down. We've done drills where a team went in overconfident. They went in and things got bad and things got worse. And instead of the team pulling out to save themselves, they floundered. And we had to end that drill early because the team just couldn't extricate themselves from the situation. Sometimes all you have to do, back out. Hey, everyone, back out, back out, back out, and get away from the situation, reassess, rethink, come up with a new plan. Then you can go back in and hopefully that plan works. If the plan doesn't work again, pull out, reassess, reevaluate, come up with a new plan. Don't bring a victim to an incident. And don't spend more than 30 to 60 seconds with each survivor. You need to move on. So coming up, we have a few drills coming up, a refresher. If you go to the CERT calendar, www.cert-la.com, if you're in the LA area, you're going to see all of the events that we have going on. If you want to sign up for my email letter, every month I send out 1 or 2 emails with the stuff that we have going on for the month. Go to certvolunteer.org and sign up. And then if you're in the LA area or in Southern California and want to come, we have a drill in the Sherman Oaks area. This is a community drill run by us volunteer coordinators. And it's going to be Saturday, March 28th from 9 a.m. to 12:30 p.m. In the Sherman Oaks community. You go to LAFD cert-drill-march 2026.eventbrite.com. You can sign up and get more information. You can also
Patrick?
go to the calendar. I posted the link cert-la.com in the chat. Our events are linked there as well. And then the fire department, LA City Fire Department, is hosting a CERT refresher in the Valley, Sunday, April 26th, 7:30 a.m. to 2 p.m. Again, that is on the CERT calendar. It is open to everyone who has graduated the CERT class. You do not have to live or work in LA City. If you're in one of the neighboring cities and want to come, oh, if you're in Florida and want to fly out for the refresher, um, it's always good. And we get a lot of CERT members. We've seen like 200 people come to these things. Um, and the actual firefighters are the ones teaching this, so it's always great to see what they put on. If you have any questions, you can email me at lafdcertcentral@gmail.com. Or if you have any questions now, I'll take questions or comments or editorials. Sally, go ahead.
Yeah, Patrick, they've changed the date for the Encino drill.
Yeah, the
They've
Encino drill got canceled. That's why we're doing the Sherman Oaks one.
oh, oh, it's a different one.
Yes,
And where is the Sherman Oaks one going to be?
in Sherman Oaks.
Do you know where?
Yeah,
I know.
it's gonna be at the corner of Albert Street and go to the
I'll go
calendar.
to,
Yeah, go to the
and
Eventbrite.
that's supposed to be on. March 28th?
Yes.
Thank you. I'll check it.
Hmm. Any other questions, comments, editorials? There's a lot of information that we threw at you. Um, Really, the best advice is don't overthink it. Really, that 32 can do is, now I'll put it up on the screen again, per someone's request. Is someone breathing faster than 30 times a minute? That's every 2 seconds. That is very fast. Does someone, as a person's capillary refill, take longer than 2 seconds? Can they follow simple directions? When in doubt, fall back to this. If they fail any of these tests, they are immediate. No ifs, ands, or buts. Don't overthink it. Mark them red, move on. If they're bleeding out, if they are not breathing, if, yeah, those are the two things. If they're bleeding out, do something about it. If they're not breathing, try and open their airway. If you can get them breathing, they have a chance to survive. If you can't get them breathing, they're dead. If you get them breathing and they're bleeding out, great. Now do something about the bleeding. If you can't get them breathing and they're bleeding out, don't waste resources trying to stop them from bleeding. All bleeding stops eventually. Unfortunately, sometimes permanently.
Patrick, can I ask you a question?
Yeah, absolutely.
Hey, Patrick, you mentioned this is Alan from CERT Volunteers
Yeah.
Network. You mentioned something about military corners. Well, I wrote a little blurb for you in the chat. So we're a military family since the Civil War. Mom made us do hospital corners because she was a candy striper. But you're right. You start your day with your bed made. You come back to a bed that's tight enough. You can bounce a quarter off it. So your entire day is structured to do it right before you leave the barracks.
Yeah, absolutely.
So,
Um, and people think that is just um
Hmm.
overdoing it, but it's again, it goes back to that at least I accomplished one thing in the morning. If I accomplish nothing else for the rest of the day, at least I accomplished that one thing. There's a question about what would you do if an injured survivor leaves the scene or the team loses track of one person? It's not great. You'd want to avoid that. However, if someone refuses care, then let them go. If they want to leave, let them go. Don't try and stop them. Well, maybe try and stop them, but don't prevent them from leaving. Say, oh, hold on, just can you stay here for a little bit? We just want to make sure you're okay. No, 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 I can't be here. Okay, all right. I'm not going to get in front of you and try and stop you from leaving. I have other people I need to worry about. Um, Also, sometimes someone refuses care and they are immediate and they will lose consciousness eventually. If someone refuses care, don't force yourself on them. If they lose consciousness, do something about it if you can. Someone's bleeding out and they refuse care. The assumption is that they would want you to save them if they can no longer refuse care. If they pass out, you put a tourniquet on them, stop them from bleeding, and then they regain consciousness magically. And they tell you to go away. All right, I'm going to go away. They take the tourniquet off and they bleed out and die. At least I tried something. Um, but everyone's entitled to refuse care as well. Yes, implied consent. If they're unconscious, it's called implied consent. Even if they have refused care up until that point, if they lose consciousness, then it is implied that they would want you to save them. Sometimes someone who is in shock doesn't know what's good for them and can violently refuse care until they pass out. At that point, you do what you can with the resources that you have, and if you can save them, great. Any other questions, comments? This was a long presentation. Thank you for all that stick around. A lot of chat. And of course, unfortunately, the poll didn't work the way I would hope it was, but next time we run this presentation, we'll try that again. All right, then, everyone, have a good night, and we'll see you back here for the next presentation. Hopefully, see you at our upcoming drills or at the refresher. And yes, this video is up on our YouTube channel. If you search for LAFD CERT coordinators or LAFD CERT, you should find our channel, and go to the live section. You'll find this video up there for replay.
Thank you, Patrick.
You're welcome.
Well, all right. It was good joining y'all all the way from Tennessee.
Yeah, thank you.
Very good presentation. Maybe this give me a little bit of a refresher on some knowledge on some things that may come in handy next month in Memphis.